So there's something we call the KDHS. It's the Kenya Demographic Health Survey. So when it was done, I think the latest was in 2022.
Okay.
We noticed that when it comes to men and women, both men and women have multiple partners. That one, today we cannot say that women are not,
Yeah.
but it was the number, and this was just on average. So it found that men were most likely to have 7 partners.
Wow.
Average. And remember, this was done using a cohort. So it's not for it's not that he's saying that you as Martin, you have 7 partners. It was just like an average. So for men, it was 7 partners. For women, it was 3.
A warm welcome to each and every one of you. Thank you so much for joining us on Martin Kimathi Talks episode 5. In case you're new to this channel, kindly go ahead and subscribe. Today's topic is quite special because one of our viewers reached out to us and requested, can we talk about the impact and effects of HIV AIDS? And I was like, that's a good topic. And that is why my guest today, not only is she a painting, but she's also a doctor. What? Yeah, I mean,
Okay.
Yeah. Does that apply in your profession?
No.
It doesn't. And speaking of profession, introduce yourself to us.
Okay. So my name is Dr. Hope. I am a medical doctor by profession. I am a health advocate on social media, and I'm happy to be here.
You're welcome.
Yeah.
I cannot add that painting there.
No.
Okay, let's scrap.
Professional.
Let's keep it professional. but anyway, today's topic, it's something that you're really subjected to, and I feel like a lot of young people walk around without enough information or enough knowledge in what's happening, especially on how HIV and AIDS is being perceived nowadays. What's your take on that before we delve more?
I think that's very true, and I keep saying this. I feel like the way we grew up is different than how people are growing up today. For us growing up, there's no day that would pass without you hearing something about HIV and AIDS prevention or like TB prevention. And these days, months can go by. So the effort that was there in creating awareness on HIV and AIDS back in the day, I feel is not the same now. And with that, there's a lot of gaps in terms of the knowledge that the youth have about this infection, how it spread, how to prevent themselves from getting it, and just a lot of things around that topic. So, yeah, I think it's nice that someone asked about it because it is a growing, let me say not pandemic, or like issue. It's a growing pain, especially for the youth. And something that you'll find is, imagine there's a lot of, let me say, under prioritization of youth health.
Okay.
So we need to, I think, talk more about this and involve them in conversations, because if you're talking about preventative health, it literally starts with them. So it starts in your formative years, and these are the things that you'll apply even in the future to prevent yourself from getting infections such as HIV and other conditions that we can prevent. Yeah.
And I like how you said, speaking of growing up, because for me personally, growing up, one of the things that my parents used to tell me is abstain. And eventually when you get, especially after high school, you don't follow that norm.
Yeah.
So what are some of the tactics that we can change in making sure that young people really understand what this disease is about?
I like what your parents are doing. For some of us,
they were like,
that was not even a topic of discussion. Why are we talking about this?
Yeah.
It was just implied. It was implied that, yes, abstinence it's either that or nothing. But when it comes to health promotion and just advocacy around a topic, we need to make it comprehensive. So you can't really focus on one aspect of it. So yes, abstinence is one of the ways to go about it, but there are other things that we should talk about when it comes to HIV prevention, and not just HIV, STIs, sexual transmitted diseases in general. So these are what we call the ABCs. So the A is abstinence, which I think we've talked about it. It's been emphasized, Then the B is being faithful. So in your relationships, being faithful to your partner. If you have multiple partners, are you having these conversations with them? Because being faithful means that I'm protecting myself, you're protecting yourself, but also we're aware about what we're doing in this relationship. So that's the second thing. And then the third thing is now how you actually protect yourself, the C, which is condomizing. So actually using condoms. And these days, when was the last time you had someone saying use a condom?
What? Nowadays, guys, it's like a secondary thought.
Yeah, and for us, it was the first, you'd hear condom, trust. Trust was everywhere.
It was like the most publicized.
Yeah. So I feel like some of these things, it's like we have preference to what we want to call awareness on such a topic, but we need to make it comprehensive. And for us as healthcare providers, what we aim to do is we aim to equip you with the information so that you can make an informed decision. So you won't come back to us and tell us, oh, I didn't know. Oh, you didn't tell me. No. We give you everything that's necessary about this. Now it's up to you to go and make the decision. So if you don't want to condomize, now it's your fault. We gave you that information. If you want to, because you've been equipped with the knowledge and you know what condomizing does and how it protects you, then well and good. So that is my take on awareness. It has to be comprehensive. It won't just be because... and we're in a Christian country, so of course, abstinence is the way to go. But let's be honest. Let's be honest.
Man. It's really
Let's
hard.
be honest. And this thing about teenagers not abstaining, it's not something new. It's happened in the past.
Yes.
It happens today.
Yes.
It'll probably happen in the future.
Yeah.
So why not equip them from the get-go so that they can start practicing safe sex practices and they can protect themselves and other people? Yeah, so that's my take on awareness. Or then something else is, it needs to be engaging.
Yeah, okay.
It needs to be engaging. This whole thing of sitting down and having a 2-hour session on, HIV is transmitted this way. Our concentration spans, if you've noticed, are very short these days.
Yes.
So if you've not captivated me within the first, let me say 10 to 15 seconds, you've lost me. I'm on to the next thing. So let's embrace the digital age. Let's reach the youth where they are. So they are on social media. Let's advocate on social media. That's what I do. I do a lot of what I do on social media because I notice people are there. You spend a lot of your time scrolling. So apart from just getting no value, let's see how we can add value. So you scroll things on, let's say, fashion or whatever, then a kahelka thing. Yeah. So we need to get them where they are. And the thing is, and the fact is, even if we don't, they will look for this information elsewhere. And the problem is, it might not be accurate. Yeah.
When you use social media, is it receptive?
Yes, it's, oh my goodness.
To what level?
It's very receptive. It's very receptive. And you find that what your followers have been doing, they start telling you, oh my gosh, thanks for that. Can you talk on this? Can you speak on this? This has helped me this way. So the thing about advocacy is you might not get 100%. So even if you get that 5%, that 10%, that is change and that is impact. Yeah. So that's how I look at it. And also, when it comes to reception, how are you engaging? Because there's some things that you know very much are taboo, or you know very much this is medical jargon. So simplify it as much to make it receptive to the audience, but at the same time, be very respectful and be very mindful of people's opinions and their perspectives of things. Yeah.
I was watching a report, and one of the main issues a lot of people complain about is at times there's lack of condoms or lack of these contraceptives in the market.
Okay.
And for you as a professional, as a medical profession, what are some of the ways that can government really instill or like really improve on in terms of helping curb the vices and the menace that comes with these diseases? Because now if I'm a person who wants to engage, then I go to maybe a shop or I go to my area and these things are lacking, of course you know what's going to happen.
Yeah. I think the first thing is the information. So information is power. The more you know, the more you're able to act. So that's the first thing that the government can do. I think they were doing it because growing up we had a bit of sex ed, like just a bit. But I think it needs to be more and it needs to be relatable.
Okay.
Yeah. So that's the first thing they can do. And I know there's been a lot of backlash when it comes to sex education in schools. But I honestly believe that the earlier they know about these things, the more they're able to protect themselves. And this is not just because of HIV, things even like HPV.
Okay.
HPV, women are exposed to it from as soon as the first time you have sexual intercourse. So why not have this knowledge and protect yourself from the beginning?
Okay.
Yeah, so education is the first thing. Then the second thing is about having youth-friendly sexual and reproductive health services. So I attended a conference recently, and that was one of the key points they were saying, that the services we offer are not friendly for the youth. You'll go there, you'll be asked why.
Yeah.
You'll be looked at like, look
like
at this one.
judging,
Kind of this judgment, yeah. And then also sometimes the facility you go to, maybe you know it's your aunt who works there, or it's someone you know. You don't know how far this information is going to reach. So some of the services we have are they youth friendly.
Okay.
So that's one way we can make the youth more receptive to some of these ways of protecting themselves. So if we are having, let's say, a clinic that offers these services, make sure that confidentiality is actually confidentiality. Whatever I say in there, it's for me and the doctor. It won't spread. And then also, if I come requesting a service, you won't turn me down because of my age. You can advise me at least and maybe give me a different option, but don't turn me down. So just make sure the services are friendly. And then something else is engaging the youth in these conversations, because we can be here formulating policies and things around them, but maybe that's not what they are looking for. So engage them in these conversations, and they'll help in actually bringing solutions or bringing change.
And just recently there was this huge conversation, and I think it just blew up nationwide, and it was trending across social media. And a lot of young people nowadays, they will prefer being infected with the virus more than getting pregnant. And when you look at it, it's very worrying, because now you get to look at it as, wow, these are the emerging trends that are happening out there. How does that concern you and just the whole medical fraternity?
Well, that's what?
Imagine, it gets to that point.
That's actually sad. I think for me, why it's very sad is, one here, because of course the woman is mostly affected. It's a girl child who's mostly affected, number one. And then number two, I think they're equal in measure. I don't think one is better than the other. Because first thing about pregnancy is the risk of falling pregnant is like once within your menstrual cycle. It's when you're ovulating or around that period. But the risk of you acquiring HIV is at any point during your cycle. And then also, it is a disease that doesn't yet have a cure. We treat it and we manage it. And so far, the management has been promising. People are living healthy with the virus. But the thing is, you don't have to get there. There are other ways you can protect yourself, as opposed to just saying, I'd rather get pregnant, but I'll have the virus and that's okay, intameza tembe. No, you can just use a condom. Or just ensure your partner is faithful. Like, there are other ways that we can go around this conversation. I don't think that is the solution.
So like for you, which are like the most preferred methods that you can advocate for when it comes to prevention?
When it comes to prevention, there's only, let me say this. You're putting me in a box. Because I think, first and foremost, it depends on you, where you are, and what you want for yourself. So I wouldn't say there's one preferred method for myself. If you want to abstain, that is one method. Very effective, the most effective. Number two, if you are in a relationship and you can ensure that it's a faithful relationship between you and your partner, that's also another way. Although in Nairobi, hiyo ni ngumu. That one is hard, especially if it's not a committed relationship. But still, even in committed relationships, there are people who dip outside. Then lastly is condomizing. It's the only effective form of family planning that protects you also against sexually transmitted infections. So those three options are available for us. And I just want to say this. I think there's been a lot of focus on family planning methods, which is good. It's good because it has protected the girl child from early pregnancies. And, the impact has been great. But I feel like at that same time, there's been a sort of neglect on STIs. On STIs. And when we talk about sexual and reproductive health, STIs are part of that. So we can't talk about this one and not talk about this one. I feel like there's a way we can have integrated conversations. If someone comes to you asking about family planning, if you're the healthcare provider, I feel like it's your duty to also educate them on STI prevention, educate them on vaccines against HPV, like make it integrated and comprehensive, and not just focus on one thing, which is the one thing they came for. That is what we call comprehensive primary healthcare. So I think that we really need to revise that conversation, because also what we instill in the youth is what they'll go by.
So true.
So for us, we were scared of HIV. To be honest, we were scared.
Like
we were scared of HIV. For them now, they're scared of pregnancy because the conversation shifted.
Also, like, there's just something that even we were talking earlier on, and we were saying one of the things that a lot of young people, especially like a number of millennials and a majority of the Gen Z is that they don't understand the magnitude like the guys did back in the 1990s. Because back then, if you will go especially to a place like, let's say, the Nyanza region, where you find a county 25% of its population it's infected.
Yeah.
And once you transverse the place, you find mass grave. And when you ask people, people tell you like, you know what, this and this person died of that. You know. And also now, if we look at the statistics now, it is estimated that annually less than 20,000 people get infected. And I know the government plan is to get down to zero infection by 2030. How possible you think? Do you think that's possible?
So I think what you've said is true. When it comes to statistics, let me not dive on that. I wouldn't say I have the exact numbers. But when we talk about zero infections, it's actually not about HIV.
Okay.
It's about AIDS. Yes. It's making sure that we don't have AIDS anymore. Because HIV is a virus. And as long as we're able to contain the virus, one, that's a good thing, but also we are able to reduce its replication in a person, because that's what would ensure that your immune system is well and it's able to protect you from getting AIDS. Yeah.
What's the difference between
HIV and AIDS? HIV is the infection. Okay. So it's the virus that actually infects you. AIDS is it's a acquired immunodeficiency syndrome. So basically what happens is the virus can lower your immune system to a point where it's not able to fight opportunistic infections. These are the infections that come when your immunity is very low. Things such as meningitis, things such as TB, things such as Kaposi sarcoma, which is like a cancer, not a skin cancer, it affects like almost every organ. Okay. And what else? Things like cervical cancer. So basically when your immune system is quite low, these infections can thrive. So that's what happens when people are not on their HIV medication. The immune system is so weakened that they get these infections. So when it was called the slimming disease, it's these infections that were literally finishing people. Yeah. But if you're taking your medication and you're taking it well, your viral load is almost undetectable and you're going to be healthy. Yeah. So it's eradicating AIDS and not per se HIV. So HIV would have to eradicate the virus itself, which I don't know where we are at that. Yeah, but the UN AIDS is trying to eradicate AIDS and not per se HIV. Yeah, for HIV they're trying to find a cure for the virus. Okay. Yeah.
And I hope they find it. And
I know.
I really hope they find it. Yeah. I'm going to take you back to, there's a point that you said on how we need new methods of engaging people. Because also there's this where growing up, how you read on books, you will see like graphics of a very slim guy, someone who's so weak, someone who's so unhealthy. And see, that also promotes stigma.
Yes.
What are some of the ways, the new engagement ways that we can use? I know social media is huge. Yeah. But how do we communicate to young people?
I think the first thing that we need to do is, first of all, remove that thing of it's a slimming disease. Yes. So we need to acknowledge how far we've come in treating the virus and managing the virus. So today, you might not know, I might be sitting here with HIV. I'm not saying that I have it, but I might be sitting here with HIV and yet I look healthy. So it doesn't mean that it's a slimming disease anymore. People walk around, they live with HIV and they're healthy, but they're adherent to their medication. So I think that's the first thing we need to do. We need to accept and acknowledge how far we've come in terms of actually managing the condition. Then the second thing is, as I mentioned, we need to start talking about these things from an early age. And I feel like in primary school, there were different approaches the teachers used. Make it engaging. Make it, what's that word? Relatable to them. Okay. You know, in a way that they can understand. Don't use big words. Try and come to their level. And the more we talk about it, the more we have these open conversations, it becomes a disease like any other. So, because we don't talk about, let's say, a cold the same way you talk about HIV. But a cold is also caused by a virus. Yeah. Okay. Yeah. So we need to normalize the conversations around it. And if you get it, as of now, we know it's not the end of the world. You can outlive someone who is even without the virus. So that's the second thing. Open conversation about it. Engage the youth from early ages. So I would say when we start talking about reproductive health, that was class 6 or class 7. Yeah. Around that part.
Around there,
yeah. This is when we should start telling them about now this STI is not just HIV, STIs in general, because the same way they would get pregnant is the same way they would contract an STI, HIV being one of them. And then the last thing I would say is how we as people in healthcare or the private sector, the NGOs, how we relate this information. So back in the day, it used to be more of an advert. You know, sometimes, an ad will come and pass and you're like, okay, but no, how more can we make it relatable to the user? So I don't have the answer today, but I believe market research should be able to get those answers. Actually go and see how people are perceiving this information, how they're internalizing it and how it's impacting them. That's a lot of research and studies. And then from there is where you start now making the content.
Okay.
So that it's being received and you're not just putting things out there just to put them out there. Yeah.
Man, I'm telling you, I'm learning so much. You know, I used to be one of those people who used to think HIV and AIDS is literally almost one of the same thing. I used to have that mentality, man.
No.
Today, I'm learning so much. And I hope you guys are learning that.
There's no AIDS per se without HIV.
Yeah. I used to look at them the same. Literally, you know.
Yeah.
And today you've really, you know, you've told me, like, now I understand the difference.
Yeah.
And when it comes to toddlers or kids who are born with it, I feel like a lot of, and it could be the case, a lot of parents hold back, or they don't know how to break out, they don't know how to start the conversation with kids who are born with it in a professional way. How can parents go by it?
Okay. Actually, I would not be the best person to speak on that. And when it comes to children born and living with HIV, there are programs for them.
Okay.
So you'd find that wherever they get their medication from, because they still will be on medication, they have programs for children, for adolescents, and for adults as well, living with the virus. So these healthcare workers would actually work with the parents, and they would train the parents on when to actually disclose this information to their child, how to do it, and then also continue now the journey with the child once that has been done, to empower them and enable them to disclose this information to their friends and to their potential spouses, but it's in a structured way. Yeah, so there are healthcare workers who just focus on that. That's their work. So there should really be no parent who is doing this on their own. Because there are avenues for them to get the assistance that they'll need, because it's very sensitive and it's very delicate. So they don't really advocate for telling a child like below 7, because the child also needs to understand your frontal lobe is not developed. So once they start getting to their puberty around 9, 10, 11 there, then they normally say that's a good time. But then again, I say that won't be the best to talk about this. But yes, it's structured.
Okay. There's also this situation where I've had someone say, like, they get burnout from taking all the drugs. Is there any way that can reduce that level of burnout? Is there like a holiday where you're being like a free a day that you don't have to take the medication?
Unfortunately, no. It's medicine for life. As of now, until we find a cure, it's for life. And what I would say is take solace. It's the same for people living with diabetes, people living with hypertension. And it's the medication that's preventing the virus from replicating. So as long as the virus is not replicating, then you're in a good place when it comes to managing the condition. So there's no day. So please, don't get tired. But also, there are different regimens. So not all people living with HIV are on the same regimen. And there's something we call pill burden. Pill burden is for anyone who has a chronic disease or a chronic condition. The more pills you give them, the more fatigued they get. So if you can try and reduce that pill burden for them, you've made it a bit easier for them. So I think these are things they should discuss with their healthcare provider, whoever offers you or rather prescribes the medication for them. These are conversations that they need to have with them, just so that they can have the best regimen for them that's comfortable for them, and that will ensure they're adherent to their medication. Because first, at the end of the day, we just want adherence so that you're okay and you're healthy. I
also came across this word called viral load testing. What is that?
Okay, so I don't want to talk about viral load testing before I've talked about actual testing. So let me just go through it. So when someone wants to be tested for HIV, there's steps to it. So counseling is a must. You need to pre and post counseling just to make sure you understand what HIV is, how it's transmitted, and everything around it. And number 2 is consent. So there's no one who can subject you to a HIV test without consent unless it's an emergency, unless. But if it's a VCT or a clinic, we must obtain consent from you. Then now you have the test done, and it can turn out positive or it can turn out negative. If it turns out negative, then we advocate that you have it done at least 3 months later, just to make sure it was not in the early stages where sometimes it can be missed. And this is especially for people who are sexually active. Then if it turns out positive, we need to repeat. So we must do a confirmatory test because we have something called a false positive. Yeah. So for confirmatory tests, we advocate for PCR. But I'm not sure if it's standard everywhere. But there must be a confirmatory test before I tell you you're actually HIV positive. Yeah. Then now, once you're living with HIV, there are things that we need to monitor. So viral load is one of them. CD4 count is another one. So viral load is the amount of virus in your blood. Yeah. So the test detects how often the virus is replicating. Yeah. So you can have a high viral load, which is bad, not good for your health, and you can have a low to undetectable viral load. That is where we want it to be, which means the virus is not replicating. Yeah. And when you have a low viral load and undetectable, let me say, there are low chances of you spreading the infection. Yeah. Then now we go to CD4. CD4 is actually the state of your body's immune system. If your CD4 count is low, that means your body is not going to be able to fight off any infections that come about due to that low immunity. If your CD4 count is high, so we say above 500, then at least we are comfortable with that. Once it starts going below 500, you'll be exposed to TB, you'll be exposed to meningitis, you'll be exposed to other what we call opportunistic infections. Yes. So viral load is what we use to monitor your adherence to the medication. CD4 count is what we use to monitor treatment, especially if it was low, because we'll need it to come up. So that's what we use to monitor. Yeah.
Wow, so much gems you're dropping here. I hope you guys are really, really taking notes.
Yeah.
And statistically, a lot of young women and girls are the ones who get infected with this virus. I was doing a certain research, and there's a doctor who was saying one of the ways to curb it is to start early, like start making young girls understand there are places that you shouldn't allow someone to touch you, you know, especially like when you look at kids. Is that a way to go about it?
Okay. I would say it's not a way that has been proven. Of course it is, because you're empowering the woman, or rather the young girl, in how to say no. That's basically what you're doing. But when it comes to now protecting young girls, number one, we need to understand what is subjecting them to this higher risk of being exposed to the virus vis-a-vis men. So there are a few things. Number one is, of course, in areas where there's poverty, where there's violence, where there's just inequalities, women are more prone to becoming subject to, such things. And with that now, they're more vulnerable to the infection. And we see this a lot in areas of low socioeconomic status. So you mentioned, what's it called? Like Nyanza. So there's a lot of fish selling. And that is also a place where there's a lot of HIV. Just because you might not have money, but you're selling, you need to get the fish. Yeah, it's a trade. Yeah, so that's like one of the places that we've seen that is a problem. Then there's also the truck drivers, especially long distance truck drivers. Then also when it comes to violence, something we noticed after post-election violence is there were many young girls who were HIV infected because of rape. Yeah. So we need to understand, okay, what is making these women more not susceptible, but more vulnerable to getting the virus. So that's one way. Then number two, so there's something we call the KDHS. It's the Kenya Demographic Health Survey. So when it was done, I think the latest was in 2022. Okay. We noticed that when it comes to men and women, both men and women have multiple partners. That one, today we cannot say that women are not, but it was the number, and this was just on average. So it found that men were most likely to have 7 partners. Wow. Average. And remember, this was done using a cohort. So it's not for it's not that he's saying that you as Martin, you have 7 partners. It was just like an average. So for men, it was 7 partners. For women, it was 3.
Wow.
If a man has 7 partners, most times the partners are women. Of course, they're men, they're MSMs, men, with sexual partners who are also men, and that's okay. But most of the time, it's women. And so if one man has 7 partners,
Wow.
and all those 7 are women, and this one man is HIV positive.
Ooh, that's a catastrophe.
Exactly.
Ready to happen.
Yeah, so that was another thing. And this doesn't say that women don't spread the infection.
Yeah.
They also do, but it's just that according to those statistics, the women are more likely to contract the virus just because of the numbers. Then something else is women are not really empowered to speak up when it comes to protecting themselves or advocating for safe sex practices. So you'd find women are scared to ask a man or their partner about their status.
Oh.
Yeah, you'd find that women are also scared to ask the man to use a condom.
Yeah.
Yeah, so that's also another way that you find that we are more prone to getting the virus. So those are just a few ways that I have seen and have read about. And yeah, so we are a bit more.
Unfortunately.
Yeah.
Does shaming play a part?
Of course, shaming plays a part because, and this is mostly in advocating, because now someone will ask you, "Can you don't trust me?"
Yeah.
And it's not really about.
Most time that's always the case.
Exactly. Yeah. So yes, shaming plays a part.
Yeah.
It does. Yeah. Yeah.
It's crazy.
Shaming, but at the same time also some fear,
Yeah.
because consent. You really want someone to ask you for your consent, but then again, if you're giving them rules like we must use this and use that, at some point they can take advantage.
Yeah.
So consent is also a very, very important thing. Yeah.
Let's look at a brighter side of things, because thanks to technology, now you can find parents who are both HIV positive and create a child and give birth to a child who's negative.
Yes.
What normally happens during that process? What is that entire process?
Okay, so during pregnancy, there's something called ANC. This is antenatal clinic or antenatal care. So this is where we instill knowledge in the mother so that they know where the potential areas that the child might get the infection. So number 1, adherence to their medication. They need to be taking their medication. Number 2, during delivery, there's some things that we need to reinforce to make sure that there's no spread of that infection from mother to baby during delivery. And then number 3 is also their partners. Remember, women are not really celibate during pregnancy, or rather we can't assume they're celibate during pregnancy. So even for couples that are discordant, you might find that this is also another time where you can still get the infection. So maybe your partner is positive but you're negative, and during that pregnancy you're still having sex. Maybe it's unprotected sex, so that's still another way that you can transmit the infection to you and to your child. Yes, so it's just around that ANC period, so empowering the women just to know how they can protect their child from getting the infection, and that it's okay that they're HIV positive. It does not mean that their child has to be born with the virus. And then also breastfeeding. So we advocate for breastfeeding, so they keep breastfeeding, because I know people think that a woman who's positive should not breastfeed. No, we advocate for them to breastfeed.
You can?
Yes.
Because I also heard that
that
if a
question
woman is positive,
no,
she should not breastfeed her child.
No. We advocate for them to breastfeed. Remember, the thing that is keeping them safe is the adherence to their medication. Yes. Yeah. But there's also some tests that we'd need to do even as a child is growing, just to make sure that they're not infected with the virus. It's just monitoring to make sure that they're not getting the virus as well. Yeah.
When it comes to hospitals, is that process more expensive as compared to someone who's negative?
No.
Or still the same?
It's the same process. There's nothing extra we do, because even someone if you came to the hospital as someone who is HIV negative, you'd still have to have a HIV test done. Yeah. So there's nothing extra that will be done. Apart from the CD4 count and the viral load, which is standard in the monitoring of a person living with HIV. But there should be nothing really extra. If there was something extra, then that would be adding to the stigma now. Because you're trying to make it equal to say that just because you have HIV doesn't mean your pregnancy journey should be significantly different from someone who's not living with HIV.
What are some of the stigmatization that you've had as a doctor that have just left you perplexed?
There's one we've always had, is sharing utensils. Sharing utensils is one of them. Something else is even just in a relationship, like people's families, when a person who is in a, let me say, a discordant couple, that's one is positive, one is negative. When you're introduced to now your partner's family, and maybe you're the positive one, there's that, why are you bringing this person? They don't want to be associated with that. So that's also another place I've seen stigma. And then lastly is with us as doctors. So of course we are told we need to wear gloves to examine, but not every instance requires you to wear gloves. Yeah. But you'd find that sometimes when it comes to someone who's HIV positive, you're finding someone gloving up, even triple or double gloving. Just to make sure you don't get the infection. But we know how the infection is spread. It won't be from touching someone, and there's no direct contact with blood.
Okay.
Yeah, for us as healthcare providers.
Okay.
Yeah.
Okay. So you can sip from a cup, so you can sip from the same cup as someone who has HIV, and nothing will happen to you.
Yeah.
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 And you can do all these other things you can.
Yes, you can, because remember, we need to understand how the virus is transmitted. So one, of course, we know is sexual intercourse. Number 2 is blood, contact with infected blood. And remember, it's not just touching it like this. You also need to have like a break in your skin.
Okay.
Yeah. Okay. So if the person has an infection, maybe, and they're bleeding from their mouth, maybe you have an infection, I wouldn't say that would be the safest thing to do, to share a cup. But if you don't have any wound or they don't have, then yeah, you can share a cup. And remember, it's not even per se just sharing the cup like this. For some people, even if the cup is washed, they don't want to use those utensils. Yeah, that's a bit much. Yeah. So just understanding how the virus is spread is one of the ways that we can curb that stigma. Because you get to understand, just by touching you, by giving you a hug, that's not one way I'll get the virus.
Wow. So many gems. But before we let Dr. Hope leave, we always have this game. It's called Pick and Why. So this
Pick and Why.
Pick and Why. This is a fun game now. This is nothing to do with medicine. It's more of you as a person. Okay. So I will mention 2 things. You'll pick one. Okay. You'll tell me why.
Okay.
Yeah.
I'm an overthinker, so I'm already thinking.
Hobby or work?
I think hobby, of course. Why? Because there's a freedom that comes with a hobby. You can do it. First of all, you enjoy it. I'd like to assume that I enjoy my hobbies, which I do. And I have control and say in the hobby that I'm doing. If I don't want to do it now, I won't do it now. If I want to, I will. When it comes to work, you don't really have control.
Yeah. And I remember we spoke about some of your hobbies. So I will use them. I'm going to use them against you to get these answers. Sleep or driving?
Sleep. Sleep. Let me tell you, there's nothing more enjoyable in this world than sleep.
So true.
Sleep. Yeah. All the time.
Even in like medically, it's
sleep is healthy.
It's healthy.
We really undervalue sleep, but it is a form of treatment. Yes, sleep is healthy.
Baking, shopping. Okay. I thought you would say baking.
I'd shop to bake. I need ingredients.
A nice one. Movies or series?
Series. Yeah, series. I miss the 24 episode, 40-minute series. Yeah.
And that's it. That's it, you know. But anyway, man, everything that we've discussed here, also you guys, you can go ahead and do more research. You can reach out to more experts. We really want to thank you, Dr. Hope, for coming through.
Thank you.
And sharing your time with us. Because when I reached out to you, you were so okay coming.
May I tell people this? I love talking about health. It's the one thing I can do for free. But no, remove that.
Scrap that free thing.
Remove that. Yeah. Okay, but I love talking about health. I can do it in my sleep. I just love it. And I love when people understand what it means for them. Yeah. So, yeah, you're welcome.
And I'm sure people can also pick a lot of gems on your social media handles.
Yes.
Can you tell us, tunakupata wapi?
Dr. Hope Simiyu. Utaweka, sijui mnaekanga wapi?
Tutaweka hapo tu.
You'll put it here?
We put it there.
Yeah, Dr. Hope Simiyu on Instagram, mostly on TikTok here and there, but yeah.
Yes.
That's it. Musiniputafute Twitter, please.
Yeah.
It's not a safe space.
Yeah, like so many people that are really not into Twitter.
It was enjoyable. Like honestly, I can say 2018 to 2022, 21. Oh my God. Twitter was the best place. But me, I do Twitter for laughs.
Okay.
Yeah. But sasa chaotic.
Chaotic ni wale.
Hey, munaweza kuwa chaotic. But yeah.
TikTok, unapatikana TikTok?
Yes, I'm on TikTok.
Do you do the dances?
No.
Okay. Can you dance?
I don't know.
You don't know.
I don't know. I think I would say I can, but I feel like dancing is one of the things someone has to tell you can dance. So I'd say I don't know. Yeah.
Okay. Thank you guys for sticking around. Make sure you like, share, subscribe. And in case there's any guest that you want to see on Martin Kimathi Talks, we are always open to listen, because it's all about having a conversation that impacts the community, that impacts the society. In case we missed anything, like I said, kindly reach out to an expert. Do more research. Don't just settle for what we've said here. This learning is an ever continuous process. And once again, just thank you, Dr. Hope, for coming through.
Karibu.
You shared a lot of hope to people out there. Until next time, take care of yourselves. Yeah.